Welcome to Assembly Update. I'm Angelo Santa Barbara, Assemblyman for the 111th Assembly District representing Montgomery, Schenectady, and Albany counties. Today we are going to talk about St. Mary's Cancer Services Program, and we have two special guests here, Margaret Brody, Program Coordinator, and Deborah Bartman, Outreach Specialist. Welcome to the show. Thank you for being here today to talk about St. Mary's Cancer Services. Maybe you could start off by telling us a little bit about your background and how you got involved.
Great. My name is Margaret Brody, and I coordinate the program in Schenectady County for St. Mary's Healthcare. I started with St. Mary's about 8 years ago. When I was a young child, I was in elementary school. My mother was diagnosed with breast cancer. And I watched her struggle and watched her go through treatment and survivorship, and kind of decided that I would go to college and learn more about the medical profession. I started in human resources at St. Mary's and had the opportunity to learn about this program and to learn about the grant in Schenectady County, and really felt a connection. So I'm thankful that I was able to assume the role and really do some outreach to the community, because I feel like in Schenectady County especially there's a tremendous need. So it's nice to be able to educate on the service in Schenectady County.
Great. Well, thanks for being here today again. And Deborah?
Yeah, I work in the Fulton and Montgomery County's Cancer Services Program through St. Mary's Healthcare, and I do all the outreach for the program. I was born and raised in Montgomery County, so I thought what better way to give back to the community than to step into the community and do as much outreach as I can to give back. So I got involved with the program in 2011, and I've been with them since. And like I said, I do a lot of the outreach, and I'm really out as the eyes of the program and ears of the program, and to bring back the information that I get from there to our program to try to get people enrolled who are eligible.
Well, great. Thanks again to both of you for being here today. Let's move into talking about the organization itself. What exactly does St. Mary's do for the community?
So St. Mary's is the grant holder for the Cancer Services Program in Fulton, Montgomery, and Schenectady counties. And as the grant holder, they are responsible for really us going out and representing the Cancer Services Program. The Cancer Services Program exists in every county in New York State, and we're lucky in that our specific counties, we've been able to screen a tremendous amount of people. The last program year in Schenectady County, we've screened 600 men and women through the program. The program offers free breast, cervical, colorectal cancer screenings for the eligible population. And for us, that means between the ages of 40 and 64 and having no health insurance. And through our work over the last several years, we've identified that people really are uninsured in our area. We've done some studies, and we've done a lot of looking at numbers and things like that, and we can really demonstrate that the need is definitely out there for the program.
Now, if people want to access the services, how do they go about doing that? Do you have I know I've seen you at various locations.
Yes.
How do people find out if they want to come down and see you and talk to you? How would they know where you're going to be?
Good question. The best thing to do is just to pick up the phone and give us a call.
Okay.
Debbie in Fulton, Montgomery, and myself in Schenectady, we're there at the office, we're out in the community. They can give us a call directly, and we'll talk to people about eligibility. We'll kind of do an assessment as far as risk, because I think that's an important component of the program, is to determine, a lot of people don't know when to get screened, what the guidelines are, and so part of our role is to really help people determine, do I need a cancer screening? What cancer screening do I need, and how do I go about it? So I think we're the liaison to help that happen.
Well, and that's a question I was just thinking. Now, how do you know? Because you go about your daily life, and you're working, you're doing your thing, you have family life, and then how do you know when, hey, it's time to stop and maybe get a screening? How do you decide?
It's difficult, because I think we get caught in the daily, the daily grind of life. I think when it hits home usually is when you have a family member that's impacted. But the guideline for us is really age, because we know that as you get older, your increase of cancer risks. Sure, there are some healthy, lifestyle choices that you can make, but we also know that cancer doesn't discriminate. And I can't tell you, when and if you'll be diagnosed with cancer. So the important message is to get these easy tests, to get screened early, because we also know that when you get screened early, if you're diagnosed, your chance of treatment and survivorship increases tremendously.
And that's, I guess, going into the next question. Okay, I decide I'm going to get screens. I think it's time. But I'm working. Am I going to be able to do this on my lunch break?
Right.
Do I have to come after work? How much time will it take to actually from start to finish?
Right. I think both programs, and you can speak as well after, I think both programs offer very flexible appointments. We have providers that work with us in Schenectady and Fulton Montgomery counties. We offer Saturday screenings, evening screenings, because that is one of the barriers that we get. And so our role is to really eliminate those barriers and to say, well, geez, I know you work Monday through Friday, but we have this opportunity on a Saturday for you to come in and get screened.
And there's weekend appointments available as well? And is there an opportunity for people to maybe just have a conversation over the phone to decide if they're going to get screening? Is there some sort of consultation before they even come in?
I think a lot, when I go into the community, I get a lot of that. They're like, well, can we contact you? How can we contact you? And what I'm seeing a lot in Fulton and Montgomery counties is that they like to talk on the phone. It's easier for them to talk on the phone than maybe in person. They feel more comfortable in the comforts of their own home. So we'll have the conversation about getting screened, about their eligibility, and to see, what a screening event will be beneficial for them. So in Fulton and Montgomery County, we have screening events that either take place. We use 2 facilities for our screening events. We use St. Mary's Healthcare, and we also use Nathan Littauer Hospital. So our events at St. Mary's vary. Some will be in the evening and some will be in the morning. And then at Nathan Littauer, usually they're in the morning time. Afternoon, excuse me, usually between 1 and 4. So we do have a vary of times that we can screen people. And typically when a woman goes to her doctor, she'll go and have her breast exam and then they give her a script for a mammogram. The wonderful thing about our program is we're kind of like a one-stop shop. They get everything done in one day. So they're able to get their breast exam and their mammogram in the same day, as well as their pelvic exam and their Pap test. So they're not having to go to a second appointment. They're not having to go through having a script and following up on another day. Everything can just happen within the one day. So it does make it a lot easier on them and a lot stressful on them than to have to make several different appointments. So that's how we screen them for breast and cervical.
And are all the screenings done at once, or is there particular ones that are done at certain times? You want to get screened for a certain type of cancer, or do you screen for a variety of them during one appointment, like you said?
We typically just screen for breast and cervical.
Okay.
That's what our program is eligible or able to do.
Okay.
We also do colorectal cancer screening, and we have what's called a FIT kit. I actually brought one with me because some people have no idea what they are. So this is a FIT kit. This is something that we mail to our patients after they've come through a screening. And basically what it is, there's a lot of information in here. I'll kind of take some of it out. It gives you instructions on how to use the kit. It's very simple. There's no special diet. They can do it right at home. And it's 2 samples that they take, and it's paid for through our program.
Okay.
It's sent out, and once the results get back to us, determining on whether they find blood in the stool or not, if there is blood detected in the stool, then we'll send them for a colonoscopy, which our program will pay for. And that's for eligible patients, men and women 50 to 64.
And these kits are available through your office if people want to call?
Right. Both programs have the kits.
And how about on the website? Is there a way to request information on the website?
Yes, both websites have a link to our direct contact information of everybody that's affiliated with the program. People can click right on that link, give our office a call. We'll do sort of an assessment like Debbie mentioned. We'll answer questions about, you're a 45-year-old woman, this is what you're eligible for, and we'll give some options as far as scheduling, physicians, things like that.
So the FIT kit, how often would you recommend that somebody maybe take advantage of this? A couple times a year? Is it once a year?
Typically, we just do it once a year.
Okay.
Our program's able to fund a FIT kit per year. for each eligible patient, whether it's a man or a woman, because like I said, we do cover both men and women for the colorectal screening portion through our program. So we'll typically do it yearly, and we'll send them out reminders. It'll pop up on our screen when they're eligible for a new screening for that year. And then we'll send them out a letter saying, oh, it's that time again.
Yeah.
You're ready for your screening. And then we'll have them fill out paperwork, and then we send them their kit.
And so the kit is done at home.
Yes.
You put the package together, and it gets sent back in.
Yep.
And of course, there's the time in between where people are wondering, once you send it in, okay, when am I going to get results back? How long before?
I would say typically 10 to 14 days is when they'll hear back from us. They're also welcome to give us a call if they do not hear from us within that time, because we can go right onto the data system and check to see the results right away for them.
And they can request this on the website. What is the website?
We have two websites. One is www.cspfschenectady.com, and the other one is www.cspfullmont.com.
And your offices are in both counties, obviously.
Correct.
And the locations are?
The Fulton Montgomery County's program, Cancer Services program, is actually housed right at St. Mary's Healthcare.
Okay.
We're located directly across the street from St. Mary's Hospital, and we're at 442.5 Guy Park Ave, right in Amsterdam.
Great, okay. Very convenient location. And in Schenectady?
Schenectady County, we're located at the Ellis McClellan Street campus on the second floor. People can just walk in and ask for us, and we'd be happy to come down and meet with them in the lobby, bring them up to our office, do some on-site recruitment as well.
Great. And I wanted to ask, are you finding that more people are taking advantage of the program over time, or does it fluctuate during certain times of the year?
I think there's hot months that we talk about cancer.
Okay.
One of those months is obviously October. So when you go into your grocery store and you see pink, I think that sort of sparks people to say, I might be eligible for a mammogram. January is Cervical Cancer Awareness Month, so we tend to see a little spike there.
Yeah.
And then March is Colorectal Cancer Awareness Month, and we tend to see a little spike there. I can tell you what we have seen is a tremendous need for the program. We've got, we enroll somebody in the program and they refer a husband, an uncle, a mother, a father. So we've got a lot of that happens. And we're really trying to get out in the community to educate. That's a big portion of our role, because not everybody's going to be eligible, but a big portion of Deborah's role is really to educate the community on the fact that you need to be screened. This is the age you need to be screened. This is the test you're eligible for. And if we can't help, we'll forward to somebody who can help. But we're really sort of navigating through that healthcare system. So people call and they'll say, I need a skin cancer screening. Not covered by the program, but it doesn't matter. We'll help them determine where to go, who to call, who can provide that service for them.
Well, that's very nice. At least you can get the ball rolling and get pointed in the right direction. You mentioned, a variety of ages. What age is good to start screening? When you're younger, you kind of don't think about these things. Like you said, as you get older, you start to think about more and more. What's a good age to start participating in a program like this?
Typically, for women, it's the age of 40. The exception to that would be is if you're in my circumstance and you have a family member, my mother, who was diagnosed with breast cancer. Sometimes the clinician wants to start that screening a little early.
Okay.
So we look at that. We look at sort of the risk factors. Do you have a first-degree relative who was diagnosed with cancer? Are you having any symptoms? For breast, do you have a breast mass? Do you have pain in your breast? Those things. But typically the guideline is at age 40. And as Deborah mentioned, for colorectal, it's really at that age 50. That's when physicians start to talk about, colorectal cancer screenings and things like that. So really, I would say 40 to, 40 up.
And is the reminders, once someone starts participating in the program, they're reminded every year that, hey, it's time to come in. So, like we said, you get busy, so it's kind of nice that you give a call or send.
We'll do them a mailing. We'll give them a mailing. So every month, we have different individuals who will be eligible for screening depending on the month that they came the year before. So that's when we'll send out the re-screening list to them, just to remind them that they're up for their annual screening. That's
great, because it comes around a lot quicker than you think, and it's very, like we said, it's very easy to forget with everybody's busy life.
That's right.
Well, we've been talking about St. Mary's Cancer Services program. We are going to take a little break, and when we come back, more about the program.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
Packers. Viking. Packers. Viking. Viking.
Red state. Blue state. Vegan.
Carnivore.
We come from different places.
Uptown.
Downtown.
Night owl.
Early
We
bird.
come to different conclusions.
Half empty.
Half full.
But when we live united, we create real, lasting change in the building blocks of life. The education, income, and health of our communities,
Live.
our families,
United.
even the person next to us.
Live united.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
When you throw away money on wasted electricity, you're throwing away everything you could have bought with it. Saving energy saves you money. Learn more at energysavers.gov.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. You know, but it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, you know, she's putting them in the same basket. Again. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
Welcome back to Assembly Update. I am Assembly Member Angelo Santa Barbara. 1170 Riverfront Center, Amsterdam, New York. 12010 is my district office address. You can reach me at 518-843-0227 by phone and by email santabarbara@assembly.state.ny.us. Welcome back to the show. We've been talking about St. Mary's Cancer Services Program. Thank you again both for being here. We went through a lot of information about the program. And we'll just continue right on. We talked a little bit about volunteering and maybe people getting involved with the program. Maybe we can share a little bit of that.
Absolutely. I think what we really could use feedback on is where to find people that might be eligible or interested in the program. And so what we're looking for is folks to give us a call. We're able to present information. So if somebody's having a function, a health fair, or a church event even, or a neighborhood association meeting, we'd be happy to come in and share information, and talk about the program and any statistics and answer any questions that people might have. We could certainly use help, you know, referring people that they think might be eligible for the program, family members, things like that. So I would say the primary thing that we could use volunteers for is just letting us know where to go in the community.
And that information will be best by phone, or is there a place on the website where people can send comments in?
Yeah, there is a comment section. So if somebody's having an event and they'd like us to come, we'd be happy to do that. They can just go right on that comment section.
Great.
They can email us, call us, anything, any way to get a hold of us is perfectly fine.
And you mentioned statistics, and
Yes.
I know that you have some interesting stats here.
Yep.
Maybe we could share a little bit of those stats.
Sure. I have statistics for Fulton and Montgomery counties only, which I can share today. And they're from the American Cancer Society.
Okay.
So in 2011, I'm going to take us back a little bit. In 2011 in Fulton County, there was roughly 11.4% of all cancers within that county that were female breast cancer. So last year in 2012, in Fulton County, the female breast cancer rates accounted for 11.8. So there was a slight increase in the amount of breast cancer findings within Fulton County in the year of 2012. So it should be interesting to see what 2013 pans out in regards to female breast cancer. And then another statistics with Fulton County is the colorectal cancer accounts. In 2011, it accounted for 11.2% of cancers within Fulton County. And then in 2012, it accounted for 10.9%. So we've seen a decrease in the amount of colorectal cancer that's being seen within Fulton County, so that's great. It's kind of giving us a sense of peace that we're doing what we're supposed to be doing within that county, and our program is working. Breast cancer, same thing. We're working in the county, but like Margaret said, if there are volunteers out there and they feel that we should be in a different part of the county, please give us a call, because we'd be more than happy to be there. And in Montgomery County, in 2011, for female breast cancer, there was 11.4% of the cancers within that county, and then in 2012 it actually stayed exactly the same at 11.4. So there was no change in Montgomery County between 2011 and 2012. And then with their colorectal cancer counts, in 2011 in Montgomery County, it accounted for 13.9% of all cancers. And then in 2012, again, it went down to 12.5%. So we've seen a decrease in Montgomery County as well with the colorectal cancer counts. So that's a good thing.
And these statistics are available through
the American Cancer Society. Yep, it's the cancer burden profile
okay.
that they set out, and it is public knowledge. So.
Yeah, and certainly it's good information to have. Is there, we talked about some decreases and increases. When people access the services, is there tips and things that people that you can give out for people to take care of, kind of keep an eye on things and take care of what healthy habits are and how they should?
I think typically when I go out in the community, and I do, because I'm at pretty much every health fair that I can be at, and I have a table that's set up, and we have a lot of information, how to do self-breast exams, to look for genetics. Does cancer run in your family? Is breast cancer a big thing in your family? So I think typically we send out as much information and have as much information available to the public on our table when we do events. And we're always willing to mail out other things, and we also have information at our table for men too, to check for prostate cancer, to see if that's something that that is going on in their family, or is it something that's happening with them. So we are looking at both men and women to making sure they're checking themselves too, not just going to the doctor, but also being cognizant of their bodies and their health. And we always have healthy fit tips that are available on our tables as well. So we kind of collaborate with a lot of community members in different things, even to how to quit smoking. That information will be on our table as well. So we do collaborate a lot within the organizations throughout all three counties. So.
Yeah, and as Debbie mentioned, healthy tips, pretty standard, no matter what cancer you're talking about. Sun, stay out of the sun.
Sure.
Huge.
Yep.
Tobacco use, good indicator of whether or not cancer could develop. And then healthy eating and exercise. Still, maintaining a healthy weight is still very good for your health and reduces your risk of cancer.
And if you're going to be in the sun, sunblock.
Yes, absolutely, sunblock.
These events are, again, they're on your website, or they're announced, or are there any other, are people that have already participated will get a mailing if there's an event in their area? How many events, approximately how many events a year do you go through?
I think within Fulton and Montgomery counties, it typically depends on the amount of individuals that need to be screened for that month.
Okay.
So in April, we have one event coming up at St. Mary's Hospital, right on the second floor. And right now we have about 24 individuals signed up for that screening event. And then we'll have another one in May. We typically work with Nathan Littauer Hospital, and we usually do 2 events with them each month.
Okay.
So, like I said, it really varies and depends on the amount of individuals that need to be screened for that month. Fulton Montgomery Partnership, like Margaret had said, they've seen over 600 individuals. Our program has seen over 300 individuals. Last year, I believe we screened 327 individuals through our program. So slightly smaller, but we are a rural area, so I think we'll typically see a little bit lower numbers in participants within our program. But we do screen at both facilities. We also use Bassett Healthcare. They have a mobile coach that will go out to Fort Plain and serve the west portion of the county in Montgomery County. So like I said, it typically depends. Usually summer months are busier for Fulton and Montgomery counties, so we'll typically see that Bassett mobile coach, which is like an RV.
Yeah, and I have seen those, and that's kind of nice that you can kind of place it wherever you need to.
Yes.
And in Schenectady County, same thing, based on need.
Yeah, we screen one Saturday every month. So we actually, our next one is coming up, not this weekend, but the following weekend on April 20th. We screen probably about 35 women on those events. And then if need arises, we'll do an evening event. And those events are done right at the McClellan campus. And as Debbie mentioned earlier, it's one appointment. We get a lot of feedback from men and women who come through the program about how simple it is.
Yeah.
And how, you know, they can't believe that they sit in the waiting room for 5 minutes before the doctor sees them, and it's very, a lot of positive feedback about being able to offer the service. And I think that's one of the things that both Deborah and I enjoy a lot about what we do, is hearing that we're helping and hearing how easy we make it, because really that's our goal. Let's take away those barriers. You know, you can't get there, we'll give you a taxi, we'll get you a bus, we'll get you there. So we do a lot of work around that. One thing I think is important to mention too is we have a case manager who we use for all 3 counties, and that person's goal is to follow up with people that have abnormal test results. So if somebody's got a diagnosis that requires further testing, it is covered by the program, and she's the liaison for that.
And if there's questions throughout the process,
Yes.
certainly that can be, the coordinator will be able to answer those
Absolutely.
questions. And the locations are very convenient.
Yes.
It sounds like it's an easy thing to do. There's no
Yes.
reason not to take advantage of it. If people want to find out more information, they can call. Let's give out that website one more time.
Okay. The Schenectady one is www.cspofschenectady.com, and they can call me directly at 347-5760.
Okay.
And then the Fulton Montgomery website is www.cspfulmont.com, and they can contact myself. The phone number there is 518-841-3726.
Great. Okay. And a couple other items. We talked about recruiting. If you can talk a little bit about that.
Sure.
Go
Well,
ahead.
actually, I do. I'm actually doing some in-reach within St. Mary's Healthcare. This is a huge thing for our program. We usually recruit roughly 5 individuals just through in-reach alone. And those are the uninsured patients that come through St. Mary's Hospital for whatever reason they may come through. We typically target 50 to 64-year-olds. That is our targeted population for the program. So typically that's the age group we target. So we do the in-reach, and we basically give them a mailing. They'll get this postcard in the mail from myself. And this postcard has my name on it and my phone number. So if they are uninsured, they're going to get this information, and then they'll give us a call, they'll give me a call, and we typically just speak on the phone a little bit, and then we give them some information via mail. And like I said earlier, it's always easier for them to, you know, in the comfort of their own home, be able to fill out that information.
Yeah.
So the in-reach piece is really huge. Typically, we see roughly 75 to 100 patients who are uninsured between the ages of 50 to 64 a month. So that's quite significant. So we're looking to increase that.
And I just noticed on your postcard you're also on Facebook, and people want to
Yes,
take
they can
advantage of
find
that.
us on Facebook.
Yes. For the Fulton Montgomery one, you can it's Cancer Services Program Fulton Montgomery Counties, so they can do a search right on Facebook, and they can find us on there. As best as technology gets, I guess, today.
Well, as soon as I get back, I'm going to have to friend you on
like us.
Facebook. And I know there's a newsletter. Again, people can go to the website or give a call to the office to get that newsletter, and updates in there and upcoming events as well. Is that mailed out to people regularly, or is it once a quarterly or monthly?
I do a quarterly newsletter in Schenectady County that's mailed out to people. If people want to request that, they can go online and just send me a quick note, and I'd be happy to mail them an update as well.
Great. I want to thank you again both for being on the show. We've certainly shared a lot of great information. If you want to learn more about St. Mary's Cancer Services program, please visit the website or give a call. It sounds like it's real easy, real convenient, and there's a lot of flexibility in getting the services. But I want to thank you for providing the information, and thank you for joining us here on the show.
Thank you. Thank you.